Hi, I'm Jennifer with Massage Magazine, and today I am joined by David Kent of Kent Health Systems. How are you today?
Great, Jennifer. How are you doing?
I'm doing great. Today we're going to talk about Kent Health Systems, and you're going to explain the system, and you have a lot of charts and products here.
Yes. I want to say thank you for everyone for taking a moment to watch and learn a little bit. My name's David Kent. I'm a practicing massage therapist. I've been in the industry for a couple decades. And in doing so, I've had to develop certain tools and resources to help me educate my patients, assess, document, and then set up customized treatment plans for their various situations. So I'm going to show you a few tips that you can integrate in your practice with or without my products, or integrate it with different resources that you have. One of the first things I do, and we all do, Jennifer, when someone comes to our office or we're out doing a chair massage or an out call, is do some type of assessment. I take it to a new level now. You know, we all have basically a small computer in our purses, in our pockets, an iPhone, a Droid, a smartphone basically, a tablet, an iPad, anything that has a camera in it. I take postural photos of people. Now, if I'm at a health fair or I'm doing chair massage somewhere, it's almost like the chiropractor doing the spinal exam. You know, the free spinal exam? People give you their name, their email, some contact information, and for free you might take a picture of them. Sometimes I set like the postural chart up over here, you know. In my office, I actually have a plumb line hanging in front, so I can get them centered on a chart and take a photo. But even if I don't have it, it's very easy to just snap a photo. No special software. It's just take a photo, zoom in, show them, hey, you have a high shoulder, or you have a forward head posture, or your shoulders are rounded. And then that helps them understand, oh, I see why the pain is in the back when I'm slumped. And now they understand why you're trying to open them up. It's a visual.
The visual tool for the client, it really resonates with them because they can see it, what they're doing wrong.
Exactly, and we all know, you know, what's the saying, a picture's worth... Right, yeah, a picture's worth 1,000 words. So instead of me trying to sell the patient, I'm doing exactly what the chiropractor, the doctor, any specialist, they take imaging. From the time we're little children, from the moment we're born, you know, they're listening to our heart, they're monitoring our pulse, they're listening to our lungs, they're taking x-rays to look at structure, they're taking MRIs. Why wouldn't we take a picture? Because the picture does show it, then the patient understands. Now, once I have that, it takes less than 30 seconds to take a front and a side view. If you go to my website, kenthealth.com, or Google David Kent, you'll find me. But kenthealth.com, I have lots of little clips that you can see, YouTube clips, or on our Facebook page at Kent Health. It's all free that you can watch, just showing you what I do. So then I'll take the people over to the trigger point charts, because it really doesn't matter what type of body work that a massage therapist is doing. A myofascial trigger point just isn't treated by a trigger point therapist, you know? I mean, whether they're doing myofascial release or cranial work or any type of, or just massage, we're affecting trigger points. And our patients don't always understand it. The way I got into massage is I suffered with a lot of headaches and neck pain, postural problems, of course, and then I had trigger points that referred into my head. But initially, when the therapist touched like trigger points in my shoulder that went to my head, I thought as a patient, are they pressing on a nerve? I mean, it was was concerning. Then they go somewhere else and press, and then like, ooh, that's that headache in my eyeball. And I tell them, and they go, oh, that's normal. Well, after about the 6th, that's normal, I kind of felt like I was getting like a beat, you know, a line, you know. I just kind of felt like that was the answer when they didn't have an answer. So here's what I do. I show them less than 30 seconds, I take a front and side view. Because the high shoulder is not going to be any different if we take a front picture than if we take a back picture. Are you with me? And their head's not going to be much different from the right side to the left side being forward. So a front view and a side view will get the point across. And then I've developed different products or charts, and when I'm in the office or when I'm in the field, you know, we're kind of under the gun, under the pressure. Sometimes the patient walks up or the person walks up, oh, can you help headaches here? Or can you help headaches here? Or can you help my thumb pain? Or can you help my knee? We can all kind of, we don't know what's coming at us. And so the first thing I did is I started, and I've owned everything on the market, trust me. From the time I got out of massage, even in massage school, I had already kind of set up my own little treatment room at home, you know, and I kind of play massage therapist, you know, and then I opened my clinic and I hung things on the wall. But anyway, the products weren't really user-friendly that were out there. Now I understand that maybe someone wrote a book and then they took all the pictures from that book to the graphic department and said, make us a chart, so some department made a chart, but they didn't really come from a therapist perspective. So first off, I color-coded the body. So for example, anything that's blue in the Ken Health System is head and neck. Whether you're looking at a trigger point wall chart, or you're looking at sections of the flip chart, or whether you had picked up a DVD program, or you needed to pick up your manual, or it's all blue. And then the same thing you'll see happens as we move into different body regions. I'll show you. So also I've added columns to the chart, because when we work on the back of the neck, or on the side of the neck, or on the front of the neck, and then we work superficial to deep, you know, the muscles right under the skin to the deep ones. So column 1 here on the head and neck chart are all the muscles on the back of the neck, superficial, in their order to deep. Column 2, the muscles of the TMJ, muscles of mastication, chewing. Column 3 is the facial expression, smiling, frowning, and then column 4 is lateral neck going to anterior neck. I added a second color coding system here where that region of the body is color coded, and this is all cross-referenced from Dr. Travell's and Simon's research. And so let's say, for example, someone came in and told me that they have pain in this temporal region, in the red area. Well, before I start the treatment, I've looked at their posture. I see they have a forward head posture. I may identify a high shoulder. And now I want to compare it, and I might zoom in to show them the forward head and what muscles are stressed. And now I just want to show you how quickly I can, based on Dr. Travell's research, I can find all the trigger points on the chart. So all I have to do is follow the dots. See how there are like 5 different dots here? These are the color zones that are cross-referenced to where this muscle refers. So the white X we see here is the trigger point, and the referral patterns in red are going through different zones. So when someone points to that, I go, well, on the back of your neck, we could have a trigger point right here. If I'm touching your shoulder and you're feeling it into your head, I'm not on a nerve, it's normal. Now, as we go a few muscle layers down, and they can see, I tell them, here we are, we have another muscle, the red square is what told me to stop. I tell them these muscles are stressed with the forward head posture, and here we might have that pattern into your temple. You might also have other patterns to the back of the head. I don't want you nervous, I'm not on a nerve. It's a trigger point. Now below that one, we have another one. Again, another muscle, the red dot was my cue. I can show them, and then this one, I tell them, this is so many layers down. You see how far deep it is? I may not even be able to treat that muscle today. Now, what did I not say but say? What did I not, when I tell you I don't even know if I'm going to be able to treat this muscle today, I basically said, you're probably going to have to come back, right? And that makes sense when you look at this, doesn't it? I mean, you almost want to make sure I get through it all. And so I can go through, I can circle everything that's needed quickly and show them all the areas that I'm going to work. Just by following a red dot, they think I'm a rocket scientist. I now can do a full treatment, and no matter what position I have the patient in, over that next 30, 60, 90-minute treatment that, you know, they have ordered, I make sure I don't miss the key things for that trigger point. And then like that, I'm just going to show you real quick. Let's say it was back pain. and they said it was low back pain. Very quickly, I can show them how many layers I need to get to just to identify all the different muscles in their body that could be causing the back pain. And then I'll end up showing them things that no one's been able to touch, or maybe therapists were scared to touch. Like, I'll tell them, this pain on your low back could be coming from the rectus abdominis, from that motor vehicle accident and the seatbelt. Your posture is showing us this psoas. So if we don't rule this out once, that could be the problem. And again, these charts are everything that's on the wall chart is in the flip chart. What's in column 1 is on page 1. What's in column 2 is on page 2. Column 3, page 3. Column 4. And then your flip chart, again, is color-coded for you. It's easy. The flip chart has a nice little, I'm beating your mic up. Does everyone hear me? Bap, bap, bap on the mic. But like, you can take the posture, and show them like what's going on and how these muscles pull down, and these muscles over here are purling the shoulder up, and this is taking your head forward, and this all wipes off with, just a rag with some water on it. It's a wet erase marker. So basically, what I did, Jennifer, was just pull together a system that allowed me to quickly educate the patient, document it, photos that I can email to them, that I can print out, attach to their file, send to an insurance company, send to a doctor. I've got a trigger point plan to identify, to rule out myofascial trigger points. I'm not saying it's always the cause, but as long as we're treating, we want to be thorough and rule them out. If I'm in a hurry at the end of my treatment, you run over a little bit, next client's early, I could real quickly just write the patient's name on there, I could write Jennifer's name, I could take my cell phone out, I could snap the photo. I know we always write our soap notes immediately after, but but this is also a good documentation that you could keep. And then the DVD programs allow you to go back and review the anatomy. They have anywhere from 60 to an hour and 10 minutes of unembalmed dissection. I also, Kent Health Systems, the products were basically developed for me as a practitioner to make a living, because I just was having a hard time as a male therapist in the area that I started and over 20 years ago, people being accepting to a male therapist, or even some of the younger therapists that worked for me. Actually, in the early 90s, my practice we had 16 therapists receiving referrals, right up till now, from emergency rooms. Most of my business is referrals from medical doctors, ER situations. There is some chiropractic referral. But it's pretty acute stuff, and it's basically people need a quick education and to get themselves set. So it didn't matter really. The system even allows a seasoned therapist to take their work to a new level, or it allows someone right out of school. Like, if these were the resources, we just can't remember it. There's no way. I don't even think Dr. Travell can remember every muscle for every pattern, if she was alive. And the other resources, talking about being able to remember another part of the chart, the wall system and the flip chart, was a muscle movement chart, because sometimes I just honestly didn't know which, I wanted to make sure I was being thorough. What is the normal range of motion for the joint? What muscles are moving it? Am I checking everything? What's the antagonist fighting against the muscles that are, there's one muscle shortening, another muscle needs to lengthen. So this chart gives me all those answers, but by the colors, I know what column to look in. Does that make sense? Green's upper extremity, red's lower extremity. And then I can find the joint, see the range of motion, and then get a list of muscles creating the range of motion there. A lot of systems that allow me to function at a high level of efficiency and thoroughness. Basically, I'm looking all the information up under the patient's nose, right? It's like they're like cliff notes or cheat sheets, but why not? It's not so important that I believe that we know everything, because we can't retain it all, but it's knowing where to look. when we need it and accessing it quickly. So that's what the system was designed for.
It's a great educational tool for therapists and also a visual resource for the client so they can see what the therapist is working on with their body.
Exactly, exactly.
Where can our readers go to find more information about this system?
Well, of course, I write articles for Massage Magazine, so you can always find us, at that Massage Magazine website, massagemag.com. They will have links back to us, but also you can call our office at 888-574-5600. I'm going to give that to you one more time, 888-574-5600. Also, Jennifer, they can go online to our website, kenthealth.com. Just like health insurance, just kenthealth.com. Also, like us on Facebook, Facebook.com/KentHealth. And there again, at the websites, and there are video clips, little YouTube clips that are just like a minute or two long, something short, with a lot of tips. And when I'm drawing on these charts, I want you to know I use a wet erase marker. So even if you don't have my system, but you have charts and they're laminated, you could use a wet erase marker, something that wipes off with water. Also on my site, I have other articles besides the ones I've written for you guys, of course, with other tips, like how to find a job, how to market yourself, how to different pain patterns, headaches, back pain. And one of these articles, they'll show you how I use the technology with the phones, with charts and different systems. So again, Jennifer, thank you for taking the time to stop by. It's always good to see you at the shows.
Thank you very much.